Good Tuesday afternoon. I'm Charity Menifee, the Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Today, I'll be joined by Dr. Keith Gray, Chief Medical Officer at the University of Tennessee Medical Center, who will give a COVID-19 update as a representative of our local hospitals. He'll join me in just a few minutes. Our moment of gratitude today is dedicated to our Medical Reserve Corps volunteers who assisted our team with contact tracing efforts prior to receiving state funding. These folks are a testament to the true volunteer spirit in our community. We are thankful to everyone who has stepped up to help during these uncertain and hectic times. Our real life example of putting the 5 core actions into play is visiting a park. With the fall weather arriving, many of you may be itching to get outside and enjoy the cooler temperatures. Visiting a park is a great way to get active and promote healthy behavior. Just remember to model the 5 core actions while you enjoy the great outdoors. Parks are great because they often allow the ability to spread out, thus maintaining at least 6 feet of distance from other people. But bring your mask just in case they're crowded and you can't stay at least 6 feet away from other folks. If you're planning on meeting friends at the park, maybe pack some lawn chairs and a blanket and spread out and have a picnic. This is a great way to enjoy each other's company while ensuring that there's not an opportunity for the virus to spread. Remember to wash your hands before and after your time outside. And as always, stay home if you aren't feeling well or have been exposed to COVID-19. These are just a few of the simple ways to ensure that you and those around you are staying healthy while still being active and enjoying this fall weather. We are continuing to test at the main health department location at 140 Dameron Avenue from 9 a.m. to 3 p.m. today through Friday. And now we'll move into the local situation. First, I want to clarify that this morning we had a simple typo on the spreadsheet that is used to update the website data, and have since corrected our data on our website to reflect the correct information. The following is our local situation for today. We have 51 new confirmed cases since yesterday's report, giving us 9,828 confirmed cases of COVID-19 since March. Additionally, we have 427 probable cases. 8,592 of our cases are considered inactive, giving us 1,530 active cases. 369 individuals have been hospitalized at some point in their illness, and 38 Knox County residents are currently hospitalized. Fortunately, we have no additional deaths to report today, keeping our total at 83. And now I'll turn it over to Dr. Gray.
Thanks, Charity, and thank you for the opportunity to be with you again. I was last here about 2 months ago, and at that point and in the previous times that I was here, we presented a lot of data, month-over-month data, and over the last 6 months, I think all of us have been inundated with data and we've gotten to the point where it's hard to know what data to trust because some of that data is conflicting. So I'd like to start today a little differently than I have in the past with my own moment of gratitude. And really is gratitude for what we've accomplished throughout this pandemic for the last 6 months. I think last Monday marks 6 months that we've been aggressively involved in navigating this pandemic. And I just want to highlight a few of the accomplishments to date. One is the collaboration. As you know, I represent all of the health systems in Knox and surrounding counties. And we've done a great job of continuing to collaborate since mid-March. We've met weekly to really try to put together a program that provides for the health and safety of our community and also our providers. We've also collaborated across sectors with Knox County and Knoxville City leadership, with businesses and also educational leaders. At the hub of those folks has been the Knox County Health Department. And I really say that intentionally because they've received a lot of criticism as of late about how they're doing things in contact tracing. And without them and without their leadership, we would not have successfully navigated this pandemic to the point where we are right now. I think the relationships that we've established during this pandemic as leaders in this community will be cemented, and they will outlive this pandemic, and they will prepare us for any crisis that we face in the future. I think the Knox County Health Department, along with the folks I've mentioned before, have been instrumental in mitigating disease spread, in mitigating the morbidity on the people that have contracted the virus, and slowing or minimizing the death in our community. And I don't want to minimize the folks that have been impacted directly by COVID and the impact on all of us, but I think the leadership that has been shown in this community has dampened the impact relative to other communities in our nation. Some quick wins. We've been able to open back up since May gradually, and we should celebrate the fact that we've been able to have the option of sending our kids back to school, whether that be elementary or high school or post-secondary education. And I lead in a way in which I never lead and propose anything that I wouldn't do in my own family. And I've sent all 5 of my kids back to 3 different schools in 2 different states successfully, and we've so far been safe and healthy. And the last thing I'll say from a quick win standpoint, I just want to really give a pat on the back again to the Knox County Health Department about the way that we've tested, the number of people that we've tested, the access that we've created, and the improvement in turnaround time that has transpired over the last 6 months. Now to some of the data, more trends than actual data. Really, this pandemic for us peaked in late July and early August as it pertains to the number of new cases per day and per week. Since then, we've had a slow downward trend in the number of cases with slight upticks around the Labor Day holiday and also with the return to school. From a hospitalization standpoint, as you recall, we again peaked in late July and early August. Since then, we've had a slow downward trend really until last week, and that was anticipated, if you will. Again, after Labor Day, we account 2 to 4 weeks after that for a time in which we would see an increase in hospitalizations, and we saw a slight uptick last week, but a manageable increase in hospitalizations. Again, we continue to work together across the systems so that no one system is adversely impacted more than the other. Our COVID hospitalizations are manageable, but I will say we are very busy with normal operations, taking care of the normal diseases that plague our community pre-COVID. We want to remain vigilant as hospital systems as also as a community. So we're continuing to take the same precautions in our systems. We're continuing to wear a mask. We're continuing to have checkpoints that are symptom checking and also temperature checking. And we're also continuing to restrict visitors in the same way and will be for the foreseeable future. We are still proponents of 5 measures, and we are also advocating, and as I know it has been mentioned on this in previous conferences, for early flu vaccines. Influenza and COVID-19 can present with similar symptoms, and we want to be able to rule out flu as a source of those symptoms. So if you are having symptoms, you need to be tested for COVID-19. And lastly, just as a word of encouragement for everyone to continue to collaborate and continue to work together to help us navigate this pandemic. The disease is real. I get a chance to see that in the community and also in our hospitals for people that have been impacted, and it will continue to be with us for the foreseeable future. And we can't give up on what has led to our success to date. We can't attack each other. We're all in this together, and we all have good intentions with the component of this strategy that we're assigned to. At each day, I would ask each one that's listening to this broadcast to ask yourself what I can do to improve the life of someone else during this pandemic. So I'll stop there and then I'll open it up for questions.
All right, if you have questions for either Charity or Dr. Gray, please type them into the chat feature. And please specify who you're looking to have answer your question. Let's see. First question we have is from Alan Sims with Inside of Knoxville, asking about the active case numbers overnight, and that piece was addressed by Charity in the opening statement. But if you have any follow-up questions, feel free to submit them. From Daniel with WBIR, at the commission meeting last night, we heard from a handful of speakers saying that wearing a mask will deprive you of oxygen. Is that true? To your knowledge, has anyone been treated for complications of wearing a mask?
To my knowledge, no one has, at least in our health system, has been treated for hypoxemia is what we call it, or lack of enough oxygen related to mask wearing. There are people that have breathing issues at baseline that may not be able to wear certain types of mask. And I had that situation a couple of weeks ago for a patient that was preparing for surgery. But after sitting with that patient and figuring out what their restrictions were, we were able to get a a mask with a less tight weave that they were able to breathe through, but also slow the spread of any respiratory droplets that may have been emitted by that patient. So to my knowledge, no impairment of breathing.
All right, next question. We're here for charity.
Oh.
Justin, musical chairs. Justin with WATE. Last night, County Commission approved a resolution to have a citizen representative on the Board of Health. Will Ani Roma be a part of tomorrow's meeting?
It is my understanding that she'll be extended an invite from the board today, I believe, and fully expect her to hopefully participate Wednesday night.
All right, any other questions? Please go ahead and submit them now into the chat feature. From Vincent with the Sentinel, the Knox County Health Department has declined to comment on the trends in symptom presentation or comorbidities in the local hospital system. Could Dr. Gray please provide this information?
Yeah, we have, as this pandemic has evolved, as we've learned more about the virus, the symptoms have evolved as well. Respiratory symptoms, fever, there have been some GI symptoms associated with it, loss of taste and smell, and others. If you have symptoms within this broad range, please, number one, be tested for COVID. And I'll use a specific example. My little boy had some of the symptoms of COVID, an 11-year-old, and we got him tested. He was negative. He didn't have all the symptoms, but he had some. So if you're suspicious, the first thing I would say is to be tested. Number two, we have not seen a demographic change in the people that are requiring hospitalization. Specifically, the live data as of this morning from the University of Tennessee Medical Center, our age range for the people that we have hospitalized is 36 to 96 with an average age of 62 with the usual symptoms. However, there has been a slight shift toward the number of acute patients in the hospital versus the number of critically ill patients. I think the last time I was with you, the state average was running around 40% of those hospitalized were in the ICU. The trends right now statewide are around 25% of people hospitalized are in the ICU. So that is a good trend.
Daniel with WBIR, we've heard from a handful of school districts that temperature checks aren't very effective. Can you speak to that at all? Is there a more effective way of symptom screening?
I think it's the full picture of screening. It's a tool in the toolkit that folks can use, but we also encourage, it's not the be all end all, obviously. And so we encourage folks to also do questions screening as well. You enter the building here and you're asked if you've been exposed to anyone. Are you feeling ill? There's different questions that you can ask to also get a better picture of what the situation might be. It's all just another method, another layer of potential protection that can be offered for your businesses or your organizations.
From Justin with WATE, says he's received a few questions from bar owners. His first question is, there seems to be some confusion over the resolution that passed in the commission last night regarding limiting the power of the Board of Health. What does that resolution mean for the Board of Health? Will it have any effect on curfews at all?
I think that's a good question for County Commission and the Law Department on interpretation of what that means. As far as we are concerned, things will continue as normal for our end, but as far as the board and what they do, consider asking the Commission and Law Department.
Justin's other question was, how strictly is the curfew policy being enforced?
As Dr. Buchanan said last night, we're not aware of any citations or closures that have occurred at this point. So really trying to, again, the message we've had the whole time is educate and inform folks on why it's important to comply with the regulations and recommendations that have been out there.
Brian Hornback, this is question for ACHD. Was last night's commission meeting productive in settling community angst?
I think you'd need to talk to the community about that. Get some feedback from them.
From Vincent with the Sentinel, I've reported on the symptoms that Dr. Gray described. Can you please go into more detail on the symptom clusters you are seeing among hospitalized and critically ill patients?
So again, I think it ranges the entire spectrum. Again, obviously we see people with fever. We see people probably with more respiratory type symptoms. that get admitted for those respiratory symptoms than any other cluster of symptoms requiring oxygenation that cannot be administered at home is the reason. And when they progress from the acute care setting to the critical care setting, it's likely due to, again, a worsening of respiratory symptoms.
From Daniel with WBIR, KCHD has previously said antibody testing is not accurate. Has there been any new data to alter your view on the accuracy of antibody testing? And should people trust or seek out that testing?
I don't know if you want to speak to it. I'll start from our side. From CDC and other health authorities, antibody testing is still recommended for more surveillance purposes, not for individual treatment decisions and course of action for those individual patients, just because of the unknown. Again, we don't really know how long those antibodies last and how long that protection is right now. There's, again, this virus hasn't been around for all that long, and so they're still doing the research on that and making decisions and determinations based on that. But because of that uncertainty right now, the guidance still is to use antibody testing for more community-wide surveillance type information and data than individual level. You want to add to it? Dr. Grace says he agrees.
From Vincent with the Sentinel, does the Knox County Health Department have guidance for upcoming fall festivities during COVID? Does the health department have any suggestions for trick-or-treating or other fall festivities?
That'll be coming out. I'm really excited. We had some good ideas that we talked about recently, and we'll be sharing those, but they are all about the 5 core actions and how to be able to implement those in a safe way so we can still enjoy the festivities as much as possible. But we'll have more information on that soon.
Also from Vincent with the Sentinel, what is the morale like at the health department following last night's county commission meeting?
I can't speak for everybody. I don't know what to say really today about last night's commission meeting. It was a late night and probably need a little bit more time to process that, but I appreciate everybody's willingness to do their civic duty and share their thoughts.
From Justin with WATE, is the mask mandate still in place?
It is as of right now, yes.
From Vincent with the Sentinel, if Dr. Gray is unable to be specific, will he or UT Medical Center release any data about what they are seeing in hospitalized patients?
Yeah, I guess I want to know specifically what types of details you're wanting to know about. As we talked about before, most of the folks hospitalized are hospitalized for respiratory type symptoms, for oxygenation type issues. Once they're stable from that standpoint, then they are able to be released home, sometimes with supplemental oxygen. If their pulmonary or their respiratory symptoms worsen, then again, they may require critical care. And if they worsen even more, they may require ventilation or to be placed on a ventilator. But I need to understand the question maybe a little bit better.
Yeah, and if you would like to clarify, we can bring that again to Dr. Gray for him to look further into. Yeah. From Brian Hornback for Charity, was last night's meeting, does KCHD feel the commission understands the complexity of the pandemic and the work of KCHD?
I can't speak to what the commission feels, to be honest, and direct about that. But I can say that we've talked about this recently, and I think that having a better understanding from the get-go of what public health does is something that we can continue to work on and try to do a better job of making sure our community is aware of the work that we've done for years in the background, and making that more in the forefront so people can be aware of that. But just to the rest of your question needs to go towards the commission for their thoughts.
All right, any other questions? Please go ahead and submit them now. Vincent with the Sentinel says, would it help if I sent the JIC and Dr. Gray a visual? I made something earlier based on the data that Dr. Shamia shared about a month ago with the Board of Health. That would be fine. You can go ahead and send it to the JIC and we can share it with Dr. Gray.
Thank you, Vincent.
Thank you. Any other questions? All right, not seeing any other questions come in. So thank you all for your time, and we will see you again on Thursday at 12:30. Have a great and safe rest of your day.